Thank you for joining us today. I'm Adam Looney. I'm the Executive Director of the Mariner S. Eccles Institute for Economics and Quantitative Analysis here at the University of Utah. We're here today to talk about occupational licensing reform. Occupational licensing laws require workers to obtain a license to practice in specific professions. Obtaining a license often requires educational diplomas or credentials, passing tests, paying fees, or demonstrating experience in a field. And licensing rules often make it illegal, or generally make it illegal, for unlicensed individuals to work at a field, and often describe the specific activities licensed professionals can, cannot, or even must provide. Such regulations can have health and safety benefits to consumers, but they also have costs. They impose barriers to entry to workers, raise costs for consumers, and limit the scope of services offered in Utah's marketplace. Upon taking office earlier this year, Governor Spencer Cox issued his first executive order to review the system of occupational licensing in Utah with an eye toward finding ways to remove barriers to licensing and limit unnecessary government regulation. Fortunately, this is a topic where the academic, economic, and policy community has gathered considerable evidence and research on the effects and efficacy of occupational licensing rules. To help inform the governor's and the legislature's efforts in this area, we here at the Mariner S. Eccles Institute have worked closely with this webinar's co-sponsor, the Center for Growth and Opportunity at Utah State University, to gather together lessons from the academic community and provide evidence-based research and advice to Utah's policymakers. In addition to this webinar, the product of this work is a series of essays and papers on the topic from experts across the country. On our next panel, we'll hear from Professor Ed Timmons, who is director of the Nees Center for the Study of Occupational Regulation at St. Francis University. He has written a framing paper, How to Reform Occupational Licensing in Utah, which is available on the website of the Center for Growth and Opportunity at www.thecgo.org. He'll be speaking with Josh Smith, who is research manager for the Center for Growth and Opportunity, about the steps Utah policymakers can and should take in their pursuit of a better licensing system. In addition, 10 authors, including Ed, have contributed their own short essays proposing specific areas where Utah policymakers could improve licensing. Those essays are available now on our website at mariner.eccles.utah.edu. We'll hear from two of those authors later today, but I wanted to provide a brief teaser that I hope will encourage you to read through what are interesting and useful essays on this topic. I'm going to try to fire them off quickly. Here goes. Many states, including Utah, temporarily suspended rules that had limited the ability of healthcare workers to provide certain services during the pandemic to increase access to care. Ryan Nunn and Gabe Scheffler observed that those changes were effective in increasing access to care without negative effects, and asked why they shouldn't be made permanent. Robert Orr recommends that Utah accept valid out-of-state medical license for new residents and make it simpler to renew those licenses. Professor Alicia Plemons focuses on scope of practice rules, which define what services licensed professionals can and can't provide. She recommends that Utah expand the services psychologists and pharmacists provide, as other states have done. Steve Slavinsky recommends that Utah expand its recognition law to recognize licenses issued by other states and limit the authority of licensing boards to deny licenses. Licensing laws often specify minimum levels of education, and it's not always clear that these requirements are set in either the consumer's or the worker's best interest. Kewen Bay argues that these rules impose high costs on students in time and student debt, and recommends delicensing certain occupations and reducing educational requirements in other fields. Connor Norris highlights how occupational licensing helps limit competition in the real estate market. Here's a fact for you. There are about the same number of real estate agents in Utah as there are in the entire United Kingdom. And that arises in part because commissions are kept artificially high by high barriers to price competition. Norris recommends several reforms policymakers could make to encourage more competition. Finally, in terms of process, Jason Sorens argues for stronger sunrise review process that assesses the likely costs and benefits of any new regulation. I encourage you to go to our webpage and read those essays. Later in this webinar, I will speak directly with two of the authors, Dr. Michael Bednarchuk, who is Senior Research Analyst from the Institute for Justice, and Professor Morris Kleiner, who is AFL-CIO Chair and Professor of Labor Policy at the University of Minnesota, Twin Cities. So stay tuned for a discussion of their papers. But right now, I wanted to turn it over to Josh Smith and Ed Timmons. Thanks.
Thank you, Adam. I'm really excited to be here, excited that Utah is making these kinds of reforms. The state has already made itself largely a leader in the occupational licensing reform space. And I was excited to see Governor Cox's first order was about economic opportunity. It's about making sure that these occupational licensing laws work as guardrails rather than closing down entire roads for people to go down to find economic prosperity. Too often, our laws just become cluttered messes. They work not like guardrails, but they close down those opportunities. And so at CGO, we got excited when we saw Governor Cox's order. And we reached out to Dr. Ed Timmons, who's a PhD economist at St. Francis University. And we reached out to Ed because he's the nationwide expert. He works with other governors across the country. He's worked, for example, with Governor Wolf in Pennsylvania, where St. Francis University is based. And he spent his entire career studying occupational licensing, trying to figure out what rules work for consumers and which are really just protecting those who hold the licenses. So when policy needs reform, you go to Ed. So I'm excited, Ed, to talk with you. I want to start out with just a simple overview question. What are the stakes for for occupational licensing reform in the state?
Well, thank you, Josh. And let me just first say that Utah is fortunate to have two fantastic research centers at both the University of Utah and Utah State University. When we think about occupational licensing, I think it's important to think of it in terms of just how many workers are affected. Morris Kleiner's estimated that 16% of workers in Utah are licensed. And just to think about that in terms of other labor market institutions, about 1.5% of workers receive the minimum wage nationally. And think about all of the time and the oxygen that gets devoted to that topic relative to occupational licensing. And we know as economists that occupational licensing, as Adam suggested in his opening remarks, that it has consequences for workers. We know that occupational licensing also has consequences for consumers. It raises the prices of services provided by licensed professionals. It creates significant inefficiencies in the labor market. And as the economy rebounds from COVID-19, I think the labor market's going to need flexibility to make sure that all of these displaced workers are able to reconnect with the workforce. And unfortunately, occupational licensing presents significant barriers to workers that are looking to start in a new field or workers that perhaps are thinking about moving into a new field. So occupational licensing affects a significant amount of workers. We know that it has consequences. And I think it's definitely worthy of more attention. And it's very refreshing to see Governor Cox devoting and issuing his first executive order on occupational licensing.
You mentioned that 16% of Utahns require a license to work. To earn an honest living, they have to get permission first. Has it always been so many people required to get a license? What does licensing look like historically?
It hasn't. Occupational licensing has grown in the fraction of workers that are directly affected. It's been estimated that in the 1950s, about 5% of workers were licensed. So in Utah, it's essentially more than a threefold increase in the fraction of workers. And when we think about occupational licensing, I think all of us probably recognize that doctors are licensed, that dentists are licensed, that lawyers are licensed. but licensing is spread to a lot more occupations where the traditional benefits that are received by occupational licensing, I think, are hard to justify relative to the costs that we know that are borne on the labor market from having licensing laws in effect. So, for example, if we think about professions like barbering, massage therapists, genetic counselors, these are all professions that are licensed in Utah, and it's not necessarily clear that the benefits that consumers receive from licensing justify the costs.
And you've worked with many states on those kinds of reforms, taking to them saying, look, your neighbors don't do this kind of thing. What should Utah learn from those past reviews? What can we learn from what's already been done?
I think there's a couple of things to keep in mind. First, if the licensing boards themselves are tasked with the job, it's important to recognize that there are some conflicts of interest that present, because the licensing boards and the individuals that they represent, they stand to potentially face some losses if licensing laws are removed or if licensing laws are significantly scaled back. And as I recommend in my piece that I wrote for the Center for Growth and Opportunity, I think it's important that when we think about occupational licensing, to always remember to keep consumers first. I think legislators and those that have good intentions when it comes to reform can oftentimes fall back and think about the consequences for the workers rather than the costs that licensing imposes on consumers. There may be consequences for workers if licensing is reformed, the licensed workers more specifically. There may be some consequences. There may be less business, for example, for cosmetology schools if licensing is significantly reformed. But one also has to weigh that with where are those benefits coming from? They're coming on the backs of individuals that don't necessarily have the opportunity to pursue a licensed profession. They're coming on the backs of individuals that might have to incur significant debt in order to go to cosmetology school and pursue their dreams. So I think it's always important to keep that consumer focus whenever thinking about licensing reform. Don't get distracted by what is this going to mean for the barbers and for the barbering schools and so forth. I think it's always important to keep the consumers first when thinking about licensing reform.
I think that's a great point. It's an easy guiding light for legislators and regulators to keep in mind. And your point about licensing boards in particular, I think, is intriguing because on the one hand, you need the expertise that those licensed members of the industry have to make good regulations. But on the other hand, it's common for researchers like yourself and Morris Kleiner and the others on today to call this, putting the fox in charge of the hen house. In Utah, for example, 75% of the licensing boards are dominated by members of the industry. They'll have a citizen who comes to the meetings and is on board, but the licensed members of the industry can always outvote them. So what kind of advice can you give Utah's review committee as it goes on about designing licensing boards in the future and making sure that licensing boards serve consumers?
So when it comes to licensing board reform, first let me preface it by saying that I would frame that type of reform as a half measure, because even if the licensing board structure were reformed, let's say that there were more public members on the licensing board, one also has to ensure that public member is present. There's some evidence that suggests that even if there are public seats allocated, that they might not go filled, that the public member might not necessarily be as engaged in the process, or they might not necessarily be as engaged because they don't have as much at stake as the licensing board members of the profession. It's the classic concentrated benefits, dispersed cost argument that Milton Friedman and others have made with respect to occupational licensing. But adding public members, having some additional oversight, I think it would be helpful in potentially preventing occupational licensing standards becoming stricter than they need to be. As an example, in Pennsylvania, the Department of State has a designated member on all of our licensing boards for the most part. I think there's one that's excluded. And that has, at least anecdotally, had some effect on the stringency of Pennsylvania's licensing requirements. But I would urge policymakers to go further than that, because as I said, it's not necessarily clear that reforming the structure of licensing boards is necessarily going to lead to the important changes that would be necessary, I think, to fully remove the barriers associated with occupational licensing. I think there needs to be a further rethinking of whether or not licensing itself is the appropriate regulatory tool in order to make sure that consumers are protected and to make sure that there aren't unnecessary costs imposed upon consumers and aspiring workers.
That's a major part of your paper with the center. What is the process for doing that kind of review? What should states look at? What are the sorts of steps they should be taking?
So I proposed a three-step process to move forward with a successful licensing review. And the first step is just checking where the state stacks up to surrounding states or nationwide. And I think it's important to point out that that's just a starting point. There are professions that are licensed in every single state, like barbers and cosmetologists, where it's not necessarily clear that licensing is the appropriate regulatory tool. Moving forward, we recommended a Fresh Start initiative. And what this would entail is an independent entity would review occupational licensing in Utah and come up with a list of recommendations. And legislators would only be able to vote on the entire package. And this would hopefully insulate the process from certain professions or certain reforms being carved out. And then lastly, we recommend that Utah strengthen its sunrise examinations to essentially make sure that the appropriate regulatory gets used from the onset, because once licensing's on the books, it's extraordinarily difficult to remove. In the last 5 years, there's been some progress in delicensing. About 35 professions have been delicensed, but in the previous 40 years, there were only 8. So licensing has remarkable staying power once it gets initiated. So it's really important to make sure that policymakers get the regulation right from the onset.
One of the questions that I think we should definitely be asking ourselves, and regulators should too, is like, well, why shouldn't we err on the side of caution? It's a natural question. Why shouldn't we make sure our rules are extra protective? For example, genetic counselors has a name that sort of gives me pause. It's a medical profession. Should we subject it to more stringent licensing, or what are the costs of being overly protective?
So it's a good question. And there are certainly benefits associated with occupational licensing, but when it comes to the empirical evidence that we have, the evidence on quality is quite mixed. There is a study that examined licensing of midwives at the turn of the century, and they do find some evidence of quality improving. But for the most part, there's just not a lot of good evidence that licensing is delivering on its intended purpose. And we have lots and lots of evidence that licensing results in significant costs. It's very well documented that licensing increases prices, that it reduces labor supply, that it creates inefficiencies in the labor market. You name it. I mean, Morris has touched just about anything you could think of. But licensing definitely has significant costs, and we just don't have a lot of good evidence on its benefits. So policymakers should always be thinking about what's the least costly way of making sure that consumers are protected. And thankfully, the Institute for Justice that Michael works with has provided policymakers with an inverted pyramid that gives a whole host of regulatory alternatives in between the market, which can serve as a regulator itself, and occupational licensing. Oftentimes, there is a less costly alternative to make sure that consumers are protected that doesn't involve the costs of occupational licensing.
I think we should take one more hard case, which are more medical professions like nurses. I think even if we agree there that those should be licensed, you've taught me quite a bit about scope of practice rules and how we can sometimes limit trained professionals from actually living up to their potential and their training. So what kinds of reforms should regulators be thinking about in the scope of practice area?
Generally speaking, medical professionals should be permitted to do what they're trained to do. And unfortunately, in a number of states, that's not the case. Utah's done a pretty good job with respect to nurse practitioner scope of practice. They made a significant change to physician assistant scope of practice this year. But as Alicia Plemons recommended and Adam alluded to, there's still room for more reform. For example, pharmacists. Idaho has really emerged as the national leader with respect to what pharmacists are permitted to do. And Utah could certainly look to bordering state Idaho for thinking about allowing pharmacists to do what they're trained to do. Scope of practice, unfortunately, often amounts to turf protection and nothing less. It's nothing with respect to protecting consumers. It's instead arbitrary caps or limits on what non-physicians are able to do. And it oftentimes prevents them from working to their full potential. And this is an ongoing challenge, right? The supply of medical professionals is a huge problem in Utah and nationwide. And there's a lot of medical professionals that unfortunately don't have the ability to work to their full potential because of existing scope of practice restrictions.
I think one of the exciting things about licensing reform in Utah and across the nation is the expansion of economic opportunity. That's the motivation here in Utah by Governor Cox. And what can we do on licensing reform for those who are sometimes left behind by economic growth and the prosperity doesn't reach to them? I'm thinking of minorities in particular. What are the effects of occupational licensing on those disadvantaged groups, whether they're minorities or immigrants?
Historically, occupational licensing has been used as a tool of keeping disadvantaged individuals out. It's been used to keep, for example, minority barbers out of the profession. There were recommendations to close predominantly African-American medical schools early on in the Flexner report. So historically, occupational licensing has been used to keep certain groups of individuals out. And unfortunately, because occupational licensing fees and the costs associated with obtaining a license, they're fixed, they will potentially affect disadvantaged folks more so. They'll feel the cost of occupational licensing more so than wealthier individuals. And I think a couple of states, and you've written about this, Josh, a couple of states have enacted reforms specifically for dreamers and for immigrants. So for example, Nevada, Arkansas, and Nebraska have enacted significant reforms to try to make sure that licensing isn't disproportionately affecting immigrants, because licensing laws may contain provisions that you meet English proficiency standards, or you might have to pass an exam that's only written in English. And of course, this disproportionately affects individuals whose first language is not English. So I think reforms like those can certainly help out immigrants. And just broadly, licensing reform, I think, stands to help out individuals that find the costs associated with occupational licensing to be too much of a burden, and essentially locking them out of pursuing a trade that they hope to aspire to do one day.
Yeah, in Arizona, for example, to receive a massage therapy license, you have to get a TOEFL score that's higher than any of the PhD programs in the state require. So I think that's a great example of the kind of straightening out that our licensing laws often need. They're sometimes just poorly suited for the service that we want them to provide to consumers. So, and I think our time's running out. So the last question is, what's the one thing that legislators and regulators and all of us should keep in mind about licensing reform going forward?
The one hang up or pet peeve, if you will, of mine is a confusion that licensing is the same thing as regulation. And as I alluded to, just because a profession is not licensed does not mean that there will be no regulation. There are a number of other regulatory alternatives that don't impose the same cost of occupational licensing, and I think can still make sure that consumers get adequate protection in the marketplace. So I would urge policymakers to not think of it in binary terms. There are a host of other regulatory alternatives besides licensing that can still make sure that consumers get the protection that they need.
That's great. Thank you, Ed. And Adam, I'm excited to hear from the rest of the panel that you've put together. And like I said, Ed's a nationwide leader on this. He's working with people across the country on these kinds of reforms. And I'm excited that he came and worked with us here in Utah.
Thank you. I too am excited about that conversation and about his advice. And thank you for that engaging discussion. I just want to remind the audience that they can submit Q&As either in comments on YouTube or through the Q&A function on the Zoom link. And at the conclusion of this next panel, we'll have the opportunity to pose those questions to the group. But before then, I want to welcome Professor Morris Kleiner, who is AFL-CIO Chair, Professor of Labor Policy at the University of Minnesota Twin Cities. He is, to me and to many economists, the godfather of occupational licensing research, and has, over the course of his career, examined the effects of occupational regulations on a wide variety of economic outcomes. And also Dr. Michael Benarchuk, who is Senior Research Analyst at the Institute for Justice, where he conducts original social science research as part of the strategic research team. And so each of you are passionate about the issue of occupational licensing reform. And I want to ask specifically about the topics you wrote about in your essays. Starting with you, Michael, you argued that regulation of certain occupations is overly burdensome and gave an in-depth case study of the cosmetology industry in Utah. Could you tell us what is wrong with how the state of Utah regulates cosmetologists and what are the consequences of those rules?
Certainly. First, thank you, Adam, and the University of Utah and Utah State University for co-hosting this symposium. Some of the widely agreed upon principles of sound licensing policy are that less restrictive alternatives should be preferred, and that if an occupation is licensed, requirements should be narrowly tailored to address public health and safety concerns without unnecessarily interfering with open occupational entry. IJ's concluded that cosmetology licensure in Utah is not narrowly tailored. Rather, state cosmetology licensing doesn't appear to help students or the public. If anything, it's only helping cosmetology schools. IJ has done prior work quantifying the requirements for licensure for over 100 occupations, including cosmetology, as part of our License to Work series. From that, we know that cosmetologists must have at least 1,600 hours of education, pay over $200 in fees, and pass 2 exams in order to earn a license in Utah. However, for an upcoming national study that we're publishing next month, IJ has shifted its focus from the structure of licensure to the experiences of those pursuing licensure. And this specific report submitted to the symposium breaks down the results for Utah. And what we found is that state-mandated cosmetology school is expensive and time-consuming. Additionally, cosmetology schools do a poor job of graduating students on time, or even graduating them at all. Furthermore, cosmetology school rarely pays off in terms of earnings, and our data also suggests that state licensing is a main driver of program length. Mandating that aspiring beauty workers compete costly and lengthy schooling might make sense if it were essential for public safety, but there are good reasons to think it isn't. Not only are most cosmetology services completely safe, but state law does not specify how much time schools should devote to health and safety. And when schools describe how much time they spend on the topic, it becomes clear they believe it can be covered in just a few hours. Our findings suggest that the current system of state cosmetology licensing is a failed model of professional development.
Well, thank you for that. One quick follow-up. So while your essay focused on cosmetology, how generalizable do you think the lessons you have drawn are for other professions? How widespread a problem is this?
Well, if we want to look outside of Utah, I can speak more broadly to what cosmetology looks like nationally, and we're going to see largely similar results. We know that cosmetology is licensed across all 50 states and DC, and that according to IJ's own rankings, it's one of the most burdensome and widely and onerously licensed occupations according to our license to work research. And if I want to preview more of the national report that comes out next month, what we see in Utah is replicated across the country with high costs, low graduation rates, and low earnings.
Thank you. Well, a similar question to Dr. Kleiner. Your essay focuses on the influence or control that national associations of licensed professionals have over the licensing rules and requirements that govern entry into their own professions. To some extent, those associations have almost appropriated control over licensing rules that ordinarily would be governed by state legislatures themselves. Can you tell us how that came to be and why you are concerned about that?
Yes, well, thank you first of all for thanks to Adam and Ed for the opportunity to bring some of my research to the policy agenda, and I'm really thankful and appreciative of this opportunity. In terms of a book that I wrote called Guild-Ridden Labor Markets a few years ago, we started to look at some of the role that professional associations have on influencing occupational licensing and especially driving the requirements. As part of this, in our essay, we look at the role that nutritionists and dietitians have in the state of Nevada, with some implications also for Utah, in the sense that Utah has, even though it has a lower percentage of the workforce that is licensed than national, it does lose a substantial number of jobs, and there are substantial costs to the state as a result or a consequence of occupational licensing. And in the case of nutritionists and dietitians, there's a commission on dietitian registration. And in order to become a nutritionist or dietitian, to either be licensed, which is, as Ed very appropriately pointed out, is a right to practice as opposed to a right to title. In Utah, dietitians and nutritionists have a right to title. In order to get that, you need to pass an exam. And the commission and generally states just pass off these requirements to various professional associations. It's true in the case of nutritionists and dietitians. It also was the case with respect to physical therapists who really passed off the job of determining who can enter to the professional association, and they ratcheted up those requirements to require, in the case of physical therapist, a doctor of physical therapy. In the case of nutritionists, as of 2024, you are required to have a master's degree in nutrition or dietary science in order to sit for the exam. And since in order to become licensed, you must sit for and pass the exam, this sets a very substantial barrier to entry for this particular occupation. So the occupations oftentimes look at not just what is, as was pointed out by Ed, what is good for consumers, but what is good for the guild. And in this case, the guild is the professional association, and they set up requirements that the states oftentimes pass along to the professional association, and they become the de facto requirements. And this flies in the face of a very important Supreme Court decision, which was North Carolina Dental versus the Federal Trade Commission, which stated that it is the job of the sovereign or the government to review occupational licensing requirements and not subcontract these out to professional associations. So the trend has been to do that. The implications are it restricts entry, drives up prices, and as Ed appropriately pointed out, with unclear or murky effects on overall quality.
Thanks. Well, one quick follow-up. So there are obviously many ways that licensed professionals influence the regulatory process. Another that comes to mind is licensing boards, which not only help set standards for licensing, but are responsible for enforcing licensing laws. Those are typically composed almost entirely of licensed professionals. Given their mandate, what do you think policymakers can do to ensure that licensing serves consumer interests rather than those who hold the licenses?
There are a couple of things. One, and this was pointed out in the overview, is to make sure there are more public members on these boards, but even that is not enough because, again, the issue that was pointed out is concentrated interest, that members of the licensed occupations have a substantial wage and employment and benefit gain to occupational licensing, where members of the board have sort of general do-gooder relationships to sitting on these boards. It's a burden. They could be paid more working at McDonald's than they can sitting at, especially now with higher minimum wages, that they could be paid more working at a menial job relative to sitting on the boards. So that's one requirement. A second issue is to take the Supreme Court decision seriously. That is North Carolina Dental versus the Federal Trade Commission. And that is to have government oversight of the boards. In the case of North Carolina Dental, the issue involved individuals who were selling tooth whitening kits in malls and spas, and the Dental Association viewed that as practicing dentistry without a license, even though you could get those kits at a CVS or Walgreens. And they restricted the ability of those individuals to provide those services and those products. And the Supreme Court said that there needs to be appropriate government oversight. So a lot of these independent boards are, as you pointed out, members of the professional association. In the case of North Carolina Dental, you had to be a practicing dentist, and there are some very clear incentives for those individuals to make sure that the members of the occupation do well relative to competitors and certainly relative to consumers.
Thanks, that makes sense. So stepping back, one element that has come up in both of your essays, explicitly or implicitly, and in the conversation with Ed, was the need for better cost-benefit analysis to evaluate regulation. And that seems to me like it's a hard problem, in part because the costs and benefits are hard to enumerate, they're hard to observe, they're difficult to measure. And so a question to either or both of you is, what costs or benefits should policymakers take into account when they examine regulations? How might they measure those costs and benefits in practice? And in your mind, where are they striking the right balance, or what are your concerns?
Well, I guess Michael is sort of tossing the ball to me, so I'll go for it for a little while. That is a couple of things. Certainly, the ability. What's the effect of additional regulation on prices? Certainly, there's quite a bit in the academic literature, certainly in healthcare, and as Ed pointed out earlier, is scope of practice, the ability of nurse practitioners to do very simple procedures like well-child exams. The ability to do that in states drives down the price of those very important procedures. Are over 600,000 per year, and at $10 a piece in terms of savings, those are $600 million just for one procedure that could be very easily handled and could be quantified. There are back of the envelope calculations in terms of the costs of geographic mobility. What are the costs of restrictions on being able to move across state lines? What are the costs of substantial entry requirements in terms of the ability to move across occupations? If you're a coder, a computer coder, and you want to become an accountant, you have the skills. What's the cost of moving from one occupation to the other, given that you have the basic tools and abilities to move from one occupation to another? And certainly looking at prices, looking at quantities, the number of people, the restrictions, how many consumers could be served as a result of restriction of entry. Those are all very easy to quantify. Certainly in healthcare, especially in the case of physicians or dentists, what are public safety benefits of occupational licensing? And that would be somewhat more difficult to assess. But in other areas, to what extent are there costs, for example, in terms of real estate agents that you mentioned earlier, versus insurance agents, and there are a wide variety of other regulatory restrictions or issues that can be raised, all the way from bonding to registration to certification, which don't provide the occupation with a monopoly, which licensing does. And there are other forms of regulation that do not provide the monopoly effects that occupational licensing does.
And with respect to cosmetology, something that I would urge when weighing the costs and benefits, especially in Utah, are to consider if there are safe niche practices that could be exempt from licensure altogether. And here's a place where Utah's been at the forefront with exempting microblading, which is a technique performed on the eyebrows. They've been regulating that via facility or salon licenses. They've deregulated hair braiding. The recently passed blow dry bill is another practice where you've shown that some practices can be exempt from licensure. Another consideration is how much of a state mandated curricula specifically addresses government's interest in public health and safety, and is the rest necessary? Health and safety is one of about 24 topics that cosmetology schools are required to cover, but it's not stated exactly how much time schools should devote to that topic. So we took a look at the curriculums of some of the schools, and when you do that, you see that many of them don't prioritize health and safety. If you go to the report, you can see it in more detail, but We had one school that spent less than 5% of their time on this topic. Another school spent less than 2% of this time. So that's another thing that Utah could do when looking at cosmetology specifically.
And I would just like to follow up with one additional issue, and that's the area that has certainly come to the forefront in terms of the public policy debate, and that's individuals with criminal records. Traditionally, individuals with criminal records have not been allowed to practice. Now, certainly, if they're involved in misdemeanors or small offenses, they in the past have been kept out of entering this 25 or 30% of the workforce that is licensed. And one thing that we're working on at the University of Minnesota is looking at the changes in statutes over time affecting criminal records, and the idea of giving people a second chance. And if they can't enter occupations like electricians or plumbers or cosmetology or hairdressers or barbers, that dramatically restricts their ability to earn a living once they have a criminal record. So I just wanted to add that as an additional petitional barrier and cost of licensing.
Sure, thank you. Again, one more call for questions from the audience or from, I'll take questions from Josh or Ed as well. Otherwise, I'm going to keep plowing forward with my own set of questions. My next question is, well, because occupational licenses are typically state level regulations rather than federal regulations, we have different examples of licensing regimes across the country. Are there obvious good examples of reforms in other states that Utah should follow? Are there pitfalls to avoid? Or are there areas where Utah just needs to go it alone?
Well, I guess I can take a first crack, and Michael can add to these issues. Certainly, Arizona has been a leader in allowing individuals to move across state lines. They've really served as the template. And many other states have followed, and to various degrees. And certainly, in the case of Pennsylvania, they've moved in that direction. Many other states have really followed up, and it allows labor markets to work more efficiently geographically. And I think those are really great areas, or that would be one very substantial, and recently is an area of low-hanging fruit. That is the ability to reduce geographic barriers to entry, and some of the work in terms of, and I'll let Michael handle this in more detail, in terms of cosmetology. Certainly, are those barriers to entry health-related, or are they really necessary for individuals to do these additional hours of training with respect to health and safety?
And that's something that IJ is considering. We think that it would make a lot of sense for Utah to consider requiring only brief training in health and safety basics for cosmetology, like it's currently required for people working in blow-dry bars. With the recent legislation that was passed this last session, people need to take about a 2-week safety course before beginning that profession. Utah could also consider regulating cosmetology via facility or salon licenses, such as what Utah already does with microblading, and perhaps valuing certification over licensure is also an option. These are reforms that have kicked around several states, but no one's been so bold yet as to pass them into law. But we'd love to see Utah do that.
That's great. Well, a question for the whole group, including Ed or Josh, in the last few minutes that we have. In your essays, in your papers, in the other contributors' essays, there were many different ideas and proposals for reform, both kind of big picture and small picture. Those included things like changes in educational requirements, expansions in the scope of practice, universal recognition of licenses issued by other states or even countries, better processes to examine new potential rules, and of course, specific examples like the cosmetology or pharmacy or dietitian industry that had particularly onerous rules. Do you have a prioritization or a sense of what reforms are important to tackle first, or advice more generally about how to structure this process in the spirit of what Ed and Josh talked about in their conversation? Like, what are the important elements of a reform?
It's a tough question, I think, to tackle. And I think part of it is that we're very early on in a lot of states enacting a variety of different reforms. So, for example, a couple of states like Arizona and Tennessee have enacted a reform called a right to earn a living legislation. And essentially what this does is it gives aspiring workers the opportunity to bring a lawsuit against the state if they think that a licensing law is unduly prohibiting them from earning the right to earn a living. And I'm not aware of any significant lawsuits, but it's relatively early on. That could very well be an effective way, I think, to reform occupational licensing. A number of other states have subjected certain percentages of their occupational licensing laws to a sunset review. So, for example, Nebraska, Ohio come to mind with this specific type of reform. And again, it's relatively early on. I'm a bit skeptical myself of sunset review. I think it's important to make sure that there are important steps laid out for what happens once the sunset review is accomplished, because I think too often in states that have sunset reviews, like Colorado, for example, there are recommendations that are made, but there's no follow through. And Colorado's been a leader, don't get me wrong. I mean, they've delicensed a number of professions like funeral directors and egg candlers, for example. But I still think that too often those reviews fall upon deaf ears and there's not necessarily a follow through with respect to those recommendations. Mississippi has a real unique reform. They have a 3-person committee that is going to review occupational licensing laws. And there are 3 people that are designated by the governor's office. This was just legislation that was passed earlier this year. So again, I think it's probably too early to tell. Florida had a deregathon, and they deregulated a number of professions last year. I think there's a variety of different ways, and it's one of the beauties of the way that the United States functions as laboratories of democracy. And there's a lot of different things that are tried, but I am really in favor of the Fresh Start initiative that I outline in my paper, and I would encourage Utah to consider implementing something like that when it's thinking about moving forward with a wide-ranging reform.
I would just add, and I'm in agreement with that in terms of the overall strategy, but certainly states like Florida, where they went for a large number of occupations, Michigan has been successful in deregulating smaller occupations. Now, Florida tried to go with a large group of occupations that they tried to deregulate, from ballroom dancers to many others that were sort of the periphery, including interior designers. That didn't meet with a lot of success because there was a lot of pushback. And one thing we haven't considered, and I sort of raised in my essay, is the idea of the guilds pushing back. And although you can think of unions as being relatively powerful, they are pretty weak relative to going against doctors and lawyers and accountants who have a great deal of political clout and can both raise a lot of money and get lots of constituents to push back against any deregulatory efforts. But the small occupations that Ed mentioned as funeral directors and watchmakers in my state of Minnesota, and city planners in Michigan. These are all relatively small occupations, but when you go for a large deregulatory push, such as occurred in Florida, there tends to be considerable pushback, and none of those occupations largely were deregulated in Florida.
One question from the audience. We talked a bit about alternatives to licensing. What are and those included things like certification or other approaches. Are there alternatives that can protect the health and safety of consumers that don't involve a license directly? Like, what are the alternatives?
So I'll just rattle off a couple. Auto mechanics, the folks that are responsible for fixing our cars. I think there's definitely a lot of health and safety ramifications. Private certification is the tool that's used to essentially ensure quality. And of course, consumers can look online and look at online reviews. And in fact, there's a study that finds that for contractors, consumers seem to be a lot more interested in those online reviews than whether or not their contractor's licensed. When it comes to chefs and wait staff, they do have to complete a short health and safety certification training typically, but it's really up to random inspections that states and local authorities perform. They're not subject to occupational licensing. Many times the folks that trim trees are not subject to occupational licensing. Instead, they're forced to obtain bonding or insurance just in case some unfortunate accident happens. And as I mentioned, the market itself, particularly supplemented with online reviews, is a significant regulator. I know that if I'm interested in finding a barber, I don't really care whether or not they're licensed or not. It's not really something that enters my mind. What I'm most interested in is what sort of reputation does the provider have? And we as consumers are equipped with a lot more information with respect to provider reputation than we were several decades ago. So the market has evolved, and I think it's important to carefully consider and make sure that the right regulatory option is being used so that we aren't unnecessarily burdening consumers and aspiring workers.
Yeah, I would just add very quickly that in order to in terms of shameless self-promotion, I have a book that Ed is contributing to on is licensing grease or sand in the labor market, and we look at some international comparisons and also reviews such as what happens to Uber drivers. Some are licensed, some are not, and there's been very little difference in terms of either customer satisfaction or health and safety measured by hard starts or hard stops. So there's very little evidence, at least the more recent evidence, that licensing does much in terms of overall health and safety.
Thank you. We are about out of time, and so I am going to, as there are no more questions, I am going to sign us off. I just want to thank all the authors who have contributed essays to the symposium. I want to thank Ed Timmons, not just for his participation here, but also for his help in organizing the symposium and the event. I want to thank my colleagues at the Center for Growth and Opportunity at Utah State University to help initiate and organize and shape this event. and also my fellow participants on this webinar. Thank you for agreeing to spend your early afternoons with us. And finally, I just want to thank the audience for tuning in. As always, if you want more information, if you want to speak with any of our experts, if you want to learn more, please get in touch. All of the material we have is available on our website, mariner.eccles.utah.edu, and you can contact me or other faculty in our institute directly from that webpage. Likewise, the cgo.org for my colleagues at the Center for Growth and Opportunity. We are very happy to help if we can. With that, thank you and goodbye.